Hello, I'm Dr. James Gardner with Grand Teton Chiropractic, and I wanted to take a minute to show you guys what some adjustment techniques are like today. I have a couple of friends who are going to assist us in this process today. So first of all, I want to demonstrate what's the diversified or manual adjustment technique, something a lot of you are familiar with already. So we're going to have you go ahead and lay on your back if you would. This first adjustment is going to show what a neck adjustment looks like. Many people wonder, how does it work, how does it look like? So this is what it looks like. So I'm going to palpate and find where the subluxation is. And I found right here is the big one for her. So I'm going to just fix that, very nice and easy. Just put it right in. On this side, other side, she has another one. Good. So we adjust in a fashion like that. So that's one method that is very common that people see. I also use my hands to do some adjustments in the middle and lower back. For example, I'll have you turn facing this way, and she is laying on her side like this, and this is to get the lower back or the SI joint to be adjusted. And I can put her in position and just put it right in place. Stand back. So this is an example of what the manual or diversified adjustment is like. I also have patients who, if they're not comfortable, can get adjusted using a tool like this. This is called an activator, and I use this tool to adjust joints as well. So for example, in this patient's case, I'll have you squeeze your fingers together hard as you can. I'm testing to see if there's any weakness there, which indicates if there's a neurologic problem, and there is. So I'm going to go ahead and fix that using this little tool by adjusting the joint right here and right here. And then we retest, squeeze it together hard as you can. The strength and the improvement of the strength is one confirmation that the adjustment was appropriate. Okay? So that is another tool, and we can use this along the spine or other areas as well. One other thing I wanted to show as far as treatment methods or adjustment methods is called the Percussor. And that's this little tool right here, and it's unique because it goes like a jackhammer motion, up and down like this, instead of in a vibrator motion, which is more of a sideways motion like this. So it's much more effective or deep tissue improving is what it can do. So for example, on this patient we have some issues with the shoulder area. So I'm going to go ahead and work on this and just put the percussor there, and I can change the speeds to whatever level will help that muscle tissue release, and also the joint in this place right here, the clavicle, is where we're trying to affect and help put it back into place, putting it down. So we'll just do that for a second. So this is an example of another method of treatment to affect not just the joint but also the soft tissue. So this is called a percussor. Okay, thank you. Let's have you guys switch out, and I'm going to demonstrate a couple of other different methods. So we'll have you come on over here and just take a seat for a moment. So the next method I'm going to show is some people don't like to have an adjustment with any of those other methods. They're either having osteoarthritis, or they're arthritic, or there's a lot of symptoms of pain, and so they'd rather have it done differently. So in those patients' cases, I use a couple of other methods. This is a cold level laser light that I use. It's 635 nanometer wavelength laser, and you can see when I shine this, I could turn it on, you can actually see the laser light right there. Okay, and I'm going to actually shine it on the area of subluxation or misalignment. In this patient's case, we have an issue right up in here. So I'm just going to shine it here for a time, and I can actually test to see when the release occurs so that the nervous system gets back to normal functioning, and that's what allows the person to heal. So this is an area that we can shine the laser light on, those areas of subluxation, and fix. So as an example, let me test her. Bring up your arm to the side, push up toward the ceiling. It's pretty weak, and I'm going to try and identify where it's weak. So I'm going to push on this part over here, push up. That's strong, and I go to here, and that's where it goes really, really weak. So I go with the laser light, and I shine it on that level, and it usually doesn't take too many seconds before the nervous system clears the issue, or the subluxation issue, and it's able to heal. It also is particularly neat with the laser because of the effects it has on energy. It helps to get more energy by increasing the production of ATP, which is the gasoline of each cell, from the mitochondria, which is a very interesting process of making more strength and and more energy. So that's enough for that one. Let's retest it. Put your arm up toward the ceiling. Good. Now let's retest that spot. Push up. And that confirms it because it's stronger now. Isn't that interesting?
Yes.
Now I'm going to have you go ahead and, if you would, lay on your back for me. Face up. There you go. Now this next method, I can also use gravity to assist me in an adjustment. In this patient's case, I'm going to check leg length, and the right side is shorter than the left, so that tells me that the pelvis is rotated, it's out of place. So I'm going to use these blocks, these are called SOT blocks, to help correct this misalignment. So we're going to stick this one right here. It's going to feel like a lumpy mattress treatment. Okay? And this one, just roll a little bit there, and right there. So we have these two blocks at diagonals, and gravity is pushing down obviously on us all the time. So I'm just using gravity's energy with these strategically placed blocks to manipulate and adjust this pelvis that's out of place. So that is another method that we can use to help patients feel comfortable. And this is very effective. This is great for a lot of pregnant women or, like I said, the osteoporotic patients. So these are some methods, and we usually leave this here for just a couple minutes or so. But I'm going to go ahead and wrap it up here today and just let you guys know there's so many methods and effective tools in chiropractic that can help you improve and get the treatment that you need. So our goal, as always, is to help you revolutionize your health.